Okay, I gotta hit pause on that. All right. I think we are live here. Let's see. I don't see a comment section. Weird. Where did the comments go? There we go. Okay. All right. I think some people are showing up now. I couldn't find it for a second. I know we have one here. There we go. Leah Munsert. Hello, hello. Carol Tart. Good afternoon. Very cool. United Kingdom representing. Tennessee. Andrea Coop. All right. I got a little coffee here to get going. The little ones have been waking us up. We have just put baby girl into a big girl bed, and she was in a kind of her little baby bed, and she couldn't get out of it. And we went to the big girl bed. She can roll out whenever she wants, and when she wakes up, the sun is very, and we have blackout curtains and everything, and she still gets up like 5 a.m. every day. So if the wife and I want to watch a little Netflix or something, or stay up late a little bit on a weekend, you're getting 4 hours sleep, maybe 5. And you do that a couple weeks in a row, it wears on you. So doozies here. Keena, Sue, Debbie, Lisa, very cool. West Virginia. Kelbell from Oregon. So cool. All over the place. Marion Phillips, Cheryl Stevens, Texas Grammy. Hello, hello. So I like it. We usually get up close to 75, maybe 100. We're at 40 right now. So good day from Melbourne. I love it. So let's talk about this case. Very interesting case. And I have, I'm going to have some pictures in the video too to show his initial presentation. And, initially it was very, very inflamed. And let's go to that because I want to show everybody who's here, because maybe not everybody has seen this. And I did link the video. Let me just go forward here. I can fast forward real quick. There it is right there. So you can see here, that's his initial presentation. And man, does that look inflamed. Oh, 2 a.m. in Australia. Okay. Very cool. Catch up tomorrow. So it is late somewhere. But we were getting a lot of people are up in the United States. So you can see this, and if you look in the back of the head there, he's got that what looks like swelling down to the right, but that's actually a little bit of Cutis Verticis Gyrata. And what that is it's a benign condition where the skin folds and furrows mimic the brain kind of folds, the gyri and sulci they call it. And it's he has a mild case, but when you go up farther on his head, you can see he has a couple lines there too. And these folds sometimes predispose you to ingrown hairs, and or an occlusion of the pore that could lead to a cyst. And this patient actually found me on YouTube. We've got lots of those coming in now, just from finding us from YouTube, which is very cool. I've had dozens, and we get phone calls a lot too now. So basically, when you have something like this, the first question I always ask is, did you feel a bump there over the last year or two, or is this brand new? And we'll answer some questions right after I'm done with this too, by the way. So sometimes it's hard. I don't see all the questions as they go up, but we will take a minute and answer questions at the end. So when you see something like this, I always ask, because I want to know, is this just a bacterial abscess where, some bacteria got into the hair follicle, you scratched it, like a little ingrown hair, and brought bacteria from the nails and inoculated himself with a staph infection? Or is it a cyst that outgrew its sac or got inflamed because he bumped it or scratched it, and then all of a sudden it swelled up, and then you get this presentation, that red swelling, oozing, crusting out of multiple pores there that you can see. So, you don't sleep when it's like this. These people, they've been through a lot, and they're like, please help. And you know, if you go to the ER and urgent care, sometimes they're just trying to do a little poke. They don't really infuse a bunch of lidocaine and try to get in there, from what I've seen, and that's just from hundreds of people that have come from the urgent cares and from the ERs, and they just give an antibiotic, which is okay and should be done, but they just kind of poke it a little and commonly don't get a whole lot out. Maybe a little fluid, but they don't get much of the cyst wall or cyst contents out. And you can see it's linked in the description of the video I posted last night, and it pops up at the end of the video, the IND procedure of this particular one. Yeah, my throat has been... I have not been getting sleep for a couple weeks, and I had a really bad virus like 2 or 3 weeks ago where I lost my voice. Deborah, thanks. Usually I'm not very raspy, but I've been raspy for a couple weeks now. And there is a lot of pollen in the air here too, and I do have a little pollen allergy, so that kind of gets me a little bit rough as well. But it's a combination of getting that little virus from the kids, from the pollen in the air, and from not getting much sleep for... It's been about 5-6 weeks now that we put baby girl in her bed. She is just... Imagine never being able to sleep in. Weekends, weekdays, it doesn't matter. Getting up at, 4:30 or 5 a.m. every single day. And, it wears on you. We try to give ourselves a break, my wife and I, to let one of us nap and then the other. But, man, when you have 2 full-time jobs, you have 3 kids under 7, try to do a YouTube channel. It's there's something going on every second of your day, so you get pretty tired. But we keep moving forward. So about this cyst, very nice guy, and we're gonna cover. I thought this was a really good case to share, and I have a couple more coming up just like it that are even bigger on the back, and it's what I constantly talk about. If you remember, and this has been, even though it says a couple weeks in the video, it's because I filmed it a couple weeks after, but this was probably 6 months ago. He had quite a bit of pain, even after we injected him. And I talk about that acid-base shift commonly. It's hard to get these completely numb. It's just hard. And he'd had an issue with this before, I think. So it wasn't the first time. It was a cyst. It had been inflamed before. And so there's scar tissue there. And when there's scar tissue, the lidocaine doesn't dissipate very well into the skin, into the dermis when you're injecting. So when that happens, you got to do a lot of shots, but sometimes you can't get certain areas that numb at all. And then you have the acid-base shift where it's more of an acidic wound, and you're putting an acid lidocaine in there. So it doesn't, we do use epi, to help with vasoconstriction. You're putting an acid into an acidic environment, and it just doesn't take as much and cause as much numbing as it should. And so you can't get too rough. And that's a big reason why ERs and urgent cares don't do a whole lot too, because they, they're not doing like an 8 or 10 point block all the way around. They just kind of numb from what I've seen. And, they just try to get a little fluid out. So it's why they don't get too rough with it as well. We try to put a lot more in, and we can get more rough, but depends on the patient, depends on the particular lesion. And that lump going all the way across the right side is that Cutis Verticis Gyrata. So that is the folds that form on some scalps. More in men, it's about 1 in 100,000. I think in women, it's like 0.26 in 100,000. So it's about 4 times more likely in men. But some patients have it severe, and it looks like their brain is on their scalp. It's so interesting. It is just these folds all the way around. They get all kinds of chronic bacterial infections, chronic ingrown hairs. So it's not a whole lot you can do about it. It's just literally the way that the folds of the skin, you can't get a scalp replacement. Sometimes if they have a bad one, you can cut out like one area and the rest isn't that bad, but usually when it's most of the scalp. He had a mild case, but this is in one of those folds, and you can see he had a pretty big fold there, and up above he's got 2 other little ones. But so so with this, when you watch that video, you can see we get a lot out. We get a lot of purulent discharge, and I think we got some sac in there, if I remember. It's been 6 months. And then let's show, I'm going to show the suture removal right now. And then it's going to kind of go through the timeline of each time I saw him over the 2 to 3 months when we did this with these pictures. And then it'll show after the stitches are out. And then I might pause as we go so I can show you. Here we go. I'll take it back to the beginning. Put myself in the corner more. Okay guys, Mr. Popsit here. You can see here, this was our inflamed pilar cyst. It was kind of draining, it kind of popped everywhere, and it had ruptured. We then had him come back because it dried up, and then we could feel that little cyst in there. We did the surgery, and it did come back as a ruptured cyst. So now this is the suture removal. It's just a little puffy and red because the stitches are in there. His body wants them out. As soon as we get those stitches out within 5 days, the redness will go down. Looks good. I barely see a seam where we cut them there. So let's get the stitches out and then we'll see how it looks. Usually it flattens out a little because we got it nice and puckered up there. So I do want to pause it there. So this was like his couple-week follow-up after we did the incision and drainage. And it actually looked like it was healing pretty well, but he did have that one little yellow kind of scab there. And if you see the original video, I have the follow-up at the end of it. And I was just pushing on it a little bit, and it squirted all the way up my glove. And like chunk of cyst wall. And I didn't even get, I was just kind of taken out, like kind of pushing to see if there's any fluid. And it all of a sudden did it. So then I was like, oh, I had one free hand. I took out my camera and had my MA start recording because it was all over my glove. So you can see the aftermath of the pop. And that was telling us something, that one, there was still cyst wall in there, which I thought there was, because I couldn't get deep on him. It was very tender for him. I said, what's your pain, 1 to 10? I think he said 20. And so we basically I tried to push out some fluid in that. And then I was like, okay, maybe there was some cyst wall that was right there and we just got it out and that's the end of it. But I was thinking to myself, ooh, this is probably going to come back. There's a cyst in there for sure. So what we did was after this, he came back about 2 months later, and you're going to see in the next picture here. You can see there that large punctum. It's almost like a dilated pore of Weiner. And there actually was cyst trailing. I could feel a little bump above that hole and a little bump below it. And then when I cut it out, which you saw yesterday, you could see it kind of trace down, and you could see that like little sac that didn't have really a bunch of purulent discharge or anything like that in it, or even much keratin. It was kind of like the lining, like almost an onion peel, and it was starting to reform. And that's what it does. And it would have just kept filling, and it was kind of getting some draining out of that pore, and that's telling us there's something in there. And so when he came back in and I could feel that little cyst reforming, we say it all the time. We drain it, and everybody's like, why didn't you get it out initially? So many comments like that. And I can just tell that's people that have never done these procedures. It's almost impossible. And when you have a hugely burst inflamed cyst, to go in there and scrape that bottom and get every last bit. And you could see in the video from last night that I posted, it was wrapped around the scar tissue. So it was embedded in the scar tissue. I cut more skin because that scar tissue was then attached to the skin. I had to trim that out to even open it up to get up under there to see where it was at. So that's, it's what you got to do. If I was just like, oh, it looks like it's probably good, and closed it, which happens a lot. There's a lot of people are like, nah, I'm sure it's fine. A year later, that cyst is right back again. And that's why people have to come in 3, 4, 5 times commonly. And if you know, you got them numb, you're in there, you know, open it up a little bit. It'll heal fine. You can close that with a good mattress stitch. It's going to cinch it down. And you'll see in a second how well the mattress stitch heals on the scalp. So, you know, it's important if you're taking the time and you're the clinician that's doing this to get in there and visualize, lift up, look up and down, and make sure that you got it. So the patient doesn't have to go through this again, and that's what your job is. That's what you're there for. So the other thing a lot of people ask is, why do you do that little ellipse cut? And it looks like a little wedge, or what's called an ellipse. And it's because to remove pores like this, and it gives us that little handle, something we can pull on that the cyst is attached to, which you saw in the video last night too. And so you can see there when we have that pore, if I just cut straight across and it tries to heal back together, it would heal, but where the pore is, it's not going to heal. And you still have the pore. They're going to have a little hole there. It could leak. And they don't like having that dilated pore showing. So it's good to cut that out. And that's what we do. So once I take the stitches out now, you can see how it flattens out. I get really close, and you can see he had a lot of peeling just because there's swelling, and it's common people react negatively to the nylon that's in there, so it peels and swells a little. That goes away in like 5 days. The swelling goes down. But if you look close, you can see where the stitches were, but in between that, you can't see any cut line where we cut and had a big cut there. It heals completely, and it's because there's no tension at all when it's healing with that mattress stitch. And let's show that right now. All right, we just got the stitches out. You can see it pulled flat a little bit. He's just a little puffy and red. It's pretty common to have some inflammation once you have that nylon in there for 2 weeks. And so you can see, I wish I had a pointer, I could point to it, but you see that band of tissue in the middle. There's a little scab above it and a scab below it. That's where the stitches were. That band of tissue is where we cut him. You don't see a line there at all. That's pretty amazing. It healed so well. But now that we did that you can see he's peeling a little bit. That's because it was pretty swollen and everything that was going on. That redness should start to settle down. We didn't see any cyst materials in there, but anytime you have a ruptured cyst, there's always a small chance of something growing back. When I said that cyst materials, we didn't get it. It didn't squirt out, but we definitely saw cyst wall lining. But we didn't see anything, so it's highly unlikely. Now he should start regrowing hair once that inflammation goes down, and we'll keep an eye on it. If anything starts, happening again or it starts hurting, we should be able to check it again, but I think that'll be the end of this one. So thanks again for popping by, and thanks to him for sharing. That's definitely an interesting case. We haven't seen an inflamed pilar in a long time. Okay, so what I thought was interesting about that was, oh, we're up to 62 for a second. That's cool. Was pilar cysts are a hair cortex cyst, and they usually have a pretty meaty cyst wall. And so a lot of times you don't see a real big inflamed one. You do see them. I see inflamed pilars, but not as much as like other cysts on the back. And usually because that wall is pretty sturdy. And they don't pop all that often. They will swell and then they retract back down. And that's how cysts grow. They will kind of swell up and then they retract and then they swell up. And when they don't retract down to what they were before. And then each time they grow a little bit. And then you kind of see that whether it's from trauma or whether it's from people scratching it or an infection. And, that can happen. But it's the interesting part of this one was it was really inflamed and we got a good bit out, and that lining at the very end of the video I posted last night, when I got up in there and I was trimming, there was scar tissue attached to that, and that would have just literally reformed. It would have taken a while probably, but that would have reformed. And so I talk about this all the time, and about that, drain the abscess, give it time, the cyst will reform. When it's not inflamed, come back and you can anesthetize it completely and really get in there and cut everything out. And this was we've had a couple examples. I have a couple more coming up, but this was a perfect example of that. And this has been 6 months. He hasn't come back. He's been doing fine. and he should be fine. That you shouldn't get another, he shouldn't get that cyst to come back, but sometimes you will get another cyst that forms. And I have seen that where I remove a big cyst and they have like one or two others around it that are so small you can't even see them 6 months to a year later because of all the tension and pulling of that is surgery for the initial cyst. A second or third cyst starts to grow. So that we see that, and so yeah, that was the whole pilar inflamed cyst abscess story from beginning to end. And I like to do those. They can take months sometimes to put those videos together. So I have it like in editing, and I record it, and then I add it to the end of that video that I already had there. It's just a lot of editing, but we get it there, and it helps us tell that whole story. So one other thing I wanted to talk about, a lot of people were asking what I watch on YouTube. And I don't have a ton of time because, I'm pretty busy to watch things on YouTube. And things sometimes pop up just when I'm going on to my channel and start playing. So I know there's like some things that play that I'm not even into. It's things coming up on the feed. But two things that I've been watching when I do have like 5 or 10 minutes, and one I just kind of found just in the last like 3 or 4 months is these guys that do the cow hooves. And I don't know if you guys have ever seen them. There's a guy called Nate the Hoof Guy, and then another one called the Hoof GP. And these are veterinarians most likely, and they come in to these farms and these cows are limping, and they have this little contraption that they snap on the leg, and the hoof is presented, and then they go and shave, and they have a grinder and they trim, and it looks like they're shaving off Parmesan, very thin shaves, and they expose these abscesses in the hoof, which is like a nail. It's like a big thick toenail. And Hoof GP, amazing. Like I have found that I can't stop watching it, and it has something to do, I know, with when I like seeing like grass mowed and the before and after. It's that whatever that is, and I think people that like to watch pops, to watch this thing that's big and then become small and be better, it has something to do with that. There's something in us that we like, and hoof trimmers. They seem to know quite a bit. They might not be vets. Yeah, I haven't seen their backstory, so I don't know. But man, are they? They're talented. They are such a niche that they're in. There's one in Scotland that's very cool, and I don't know if it's one of those guys I mentioned. It might be the Hoof GP. He's got this strong Scottish accent, which makes it even more fun to watch. And they see pebbles up in holes. They sometimes have cows that will have 4 or 5 that present with like this thin lesion, and they're stepping on something metal in the field, and they diagnose that and let the farmer know, which is amazing. It's very cool to watch them pare it down, expose the lesion, lift up the other side with a kind of rubber glue on spacer, so then the cow can walk around with no pressure. It's so cool. I really like that. The other one I watch, which not a lot of people watch, is spelunking and cave exploration. And the reason why serotonin hint, I bet. The reason why I watch it is because I'm a little claustrophobic. And these guys getting down where they have to turn their heads sideways to get through only 10 or 11 inches of a limestone cave and squish through with their toes pushing them, and sometimes their arms at their side. My pulse goes up from 60 to 90, like literally have a visceral reaction. And it is, I can't stop watching it. It's so weird. So that's something that I will go down a wormhole. I'll watch like video after video, and they're going in. Some of them they're like underwater, and these give people like reactions. So they literally, they feel claustrophobic. I don't really enjoy it. I just can't stop watching it. And you see some people have like a nervous breakdown when they do it. It's so crazy. So I do, those are two things that do come up on my feed, I know. And then the more you watch some of that, then they just start coming up. Just that's what YouTube does. But that's some of the things I watch. This week I didn't do a whole lot on the channel, and man, I have been so busy. My two medical assistants that have been with me for 8 years, they had other things come up in their lives, and they moved on, and they have been a staple with me, and have been with me for a couple different jobs. And, sometimes when you're in a big practice, they can move them around, or, spelunking. Byron used to be a spelunker. And that's so cool. I think I would be able to get into some of it and get in and see these underwater caverns in different types of stone, and the way it reflects. And then some people going in underwater rivers. Man, it's too much. They get out and you feel such a relief. And I know there's a ton in the United Kingdom. I know there's a huge cave system, and there's underwater rivers and everything. And I know by the Appalachian Mountains, I think, and it goes all the way to New Mexico. There's a cave system, or Texas. I know we have it over here too, and there's some people that are really into it. I'm into watching it. I don't need to go in. But yeah, coming back. So, training new medical assistants, and those are the people who record for me. It's unfortunate, they have families and things, and sometimes they just need to take time off, or kids that are getting older and other things that are going on. It is a shame. I usually have 2 MAs, and I know we're hiring now. So if you are a medical assistant, you do have derm experience, and you do live in my area, come on in. We'll interview you. It happens, people move on to other jobs or other things. They're great. They were the 2 best medical assistants I've ever had, Elva and Maria, and I will miss them dearly, but they're still around, and you never know. Things come back around. I've been in this business long enough that it's a small community. People kind of go to other places and come back around again. So that's good. So yeah. That's what was going on this week. I've had charts I have to do. They're good scribes, so they would write my charts for me. Kind of the things that I say. So when you're training, it takes extra time. But we have other MAs. They're great too. We have so many offices. They kind of shift them around. So you may see some of those, or some new names on some of the videos coming up. Some of the newer videos. So that'll be happening. So yeah. Let's answer. I know if some people had some questions, so this is the time I can answer some notification. Oh, thanks, Wheezy. Very nice of you. That's very cool. Yes, I always try to stay positive, even when you're having a bad day. When you're seeing a high volume, it's easy to get pretty tired. And I do see Elvis seemed like a mind reader. Lauren, you're so right. And I'll tell you this, the reason for that is because they are an extension of your brain. Any medical provider, when you're with a medical assistant and somebody who's in the room with you every day for hundreds of patients a week for year after year after year, they are a mind reader. They literally know what you need next. And not only that, they know, depending on, and here in the United States, we have lots of different insurance profiles, HMOs, PPOs, Medicare, and they all have different approval. It's very difficult, actually, and they don't teach you that in when you're in medical school, but it's difficult. It's a maze that you have to figure out as a clinician what you can get covered. Sometimes you can't get the best medication for the patient. You have to get the second or third best, because that's the only thing that's covered. If they fail that, then usually you can go to the best medication, but it's restricting, and it's just part of the system. No system is perfect, but we get there. We do get there. But yeah, that was a good observation and a correct one, Lauren. So, and yeah, I try. It's it's important to me for people to feel comfortable. Not only, I had a business undergrad degree, marketing and management, and that was my undergrad. And then I did my prerequisites for PA school, and then PA school, which is a lot of science and medicine. But you know, anything you open up and any business, and it is a business. Unfortunately, medicine is a business, and it's a service provided for money. And anytime you have a business, if you don't care about, I am still live. Yes, XXXX. um, if you don't care about your outcomes or what people think or say, then you're probably not going to have as successful of a business as you could. And I knew that from being very, when I was a teenager. My dad had his own business, a CPA firm, but repeat business is what keeps your business going. So, and I think the YouTube channel is a perfect example how you can put somebody at ease before they've ever even seen you, that they can come in and, let me see one sec here. They come in and they feel like they already know you for one. They already know maybe the procedure and how it's going to go. I think a YouTube channel is, in this type of video format for procedures and being able to interact is a perfect way to show that example of what you're capable of. And it's just a great addition to any medical practice. Can it be done incorrectly? Sure. Can you overshare? Yeah, but if you respect the patient's privacy, which I do, and some people want to be shown, and most I say, you don't need to be shown. We don't have to show. We can do this without showing anybody's identity a lot and very easily. Most of my videos, I don't show their identity. So, yeah, it's something I enjoy though. There was a time when I was a teenager that I kind of was like, man, I would like to be a director, because just seeing how, I think it was some Steven Spielberg thing that I watched, and the way you can form the vision of your idea, I think is spectacular. It's fun. It's a challenge. And what I tried to do with the slow motion and the close-ups and some of the things that I put in there and music to add feeling, I haven't seen a whole lot of that in these types of videos. So it's something that I enjoy. I enjoy the challenge, and I think that it's made a difference. I think that it's really affected our growth early to getting up to 250,000 subscribers relatively quickly. And then, there's other things that after that happened, the restrictions, and it's stunted our growth, but that's okay. We got to a place where we have a great community, and it's been quite fun. So, I hope that it brings positiveness out there. There's a lot of negativity in the world, and even, trying to stay smiling and stay positive and find the good in things. And I tell that to my patients all the time. Every day you get up is a good day. You're still waking up and being able to see the sun. And then, that's a good day. We're lucky to have our health and still have a beating heart. That's important. So, yes, in a way, I am the director of surgery, for sure. That's a good point, Sandra. Very cool. So I think we're going to take the little kiddos on a big hike somewhere today. It's kind of overcast here and in 65, maybe 70 degrees, which is so perfect for long hikes. So I think that'll be it. If anybody has a question, I'm going back up and seeing to make sure I didn't miss any. But yes, it's a baby formula crisis. Oh my goodness, for sure. We don't have littles on that anymore, but I do have friends, and man, I hope some relief is coming soon. Let me see here. Yes. So I think we're good. Yeah. So we got up to almost 70 people. I appreciate the support, everyone. Very cool. I hope you guys have a great weekend. I think I'm going to do another live tomorrow on skin cancer. This is Skin Cancer Awareness Month. So I'm probably going to advertise it on the main channel under the community page. I'm going to put some stuff together. I'm probably going to do it at 11 a.m. So we will have a on melanoma, squamous cell, and basal cell carcinoma. And skin cancer, melanoma awareness, skin cancer awareness. It's good to pop on there and do something about that. I'm going to show some pictures. I talked intermittently about those before. So we'll do like a little pop talk about that tomorrow. Just, quick 20, 30 minutes and just some awareness and some stats about that. So you guys have a great day. Have a great weekend. Thanks for popping on here, and we will see you soon. Thanks for popping by.